about patient education. Patient education is the process by which health professionals and others impart information to patients and their caregivers that will alter their health behaviors or improve their health status. The basic focus of health education is to change and improve societal health behaviors of the patients. Some of the benefits of patient education are enabling patients to assume responsibility for their own health care. Second, providing patients with the opportunity to practice prevention techniques at home. Increasing patient trust and satisfaction and loyalty. Increasing opportunities for treatment acceptance. Ensuring continuity of care between appointments. Helping patients decide the best plan of action. And improving communication between you and your patient.
Hi, I'm Lashinna, working as a pharmacist at Hospital Wide. Invokana is a new class of drug called as SGLT2 inhibitor, which stands for sodium glucose cotransporter 2. Basically, it is involved in the reabsorption of glucose from the kidney. It actually works on kidney, which actually helps to bring down the blood sugar level by increasing the excretion of glucose in the urine. Basically, this Invokana consists of two types of dosage, which is 100 mg and 300 mg pills. So, people with this type 2 diabetes actually they reabsorb the glucose too much. So, when we give SGLT2 inhibitor, it will interfere this glucose absorption. So, patient starts to lose glucose in the urine. In essence, they become a bit glycosuria. When this happens, serum blood glucose levels fall, and to some degree weight also falls because people losing more calorie in their urine. So what are the benefits of Invokana? Primarily, the benefit of Invokana is it's very effective in bringing down your A1C1 level, which is used to measure your blood glucose level. The secondary benefit will be Invokana is not a weight loss drug, but it helps you to lose weight, and it is considered as the secondary benefit of it. And the secondary benefit of it will brings down your blood pressure. So, how do you choose a patient's medication? Our assessment on medication prior to prescribing information will be, is this medication safe for the patient, and at the end of the day, the benefits of this drug outweigh of the risk. Usually, we as the pharmacists have to go through them one by one in the prescription and making sure that the patient is aware of what are the side effects of this drug.
Actually can cause important side effects including dehydration, which may cause you to feel dizzy, faint, lightheaded or weak upon standing. Other side effects may include kidney problems, genital yeast infections, changes in urination, high potassium, increases in cholesterol, risk of bone fracture or urinary tract infection, possibly serious. The side effects of taking Invokana are yeast infection, urinary infection, low BP coming from dehydration. Patients who own Invokana will suffer from bone fracture. So, what are the possible serious side effects? Invokana may increase your risk of lower limb amputations. Amputations may involve the toe, foot, or one or both legs. Diabetic ketoacidosis. There are one of the serious side effects. Diabetic ketoacidosis is an acute complication of diabetes when there is too little insulin. That means when your body cannot adequately use glucose. So your glucose level typically go up and eventually your blood glucose level will go very high. The presence of DKA, which is diabetic ketoacidosis, is something typically looked at type 1 diabetes. It can happen in type 2 diabetes, but it is a rare occurrence. What are the symptoms
of DKA, which stands for diabetic ketoacidosis. The symptoms of DKA include lethargy. People really feel wiped down, tired, easily fatigued, and they start breathing really heavily, deep, and fast. So how can we reduce all those possibilities of side effects? The first thing that we have to advise patient is to take the medication as prescribed at right dose at right time. To accompany that, adequate hydration. The role of a healthy diet will eventually improve the success of Invokana. So whenever you experience a side effect, refer to the doctor immediately if face any side effects, like as I mentioned before. So what we hope from the patient is they totally understand. What I hope from the patient is that they understand totally there is no cure for this disease, but that we can actually treat the disease, not only treating the blood sugar level, but we can treat this disease in a way that they can live relatively no more amputative, and they are in charge in managing the disease. And our hope as pharmacists is they can stay free of risk of complications.
First of all, what do you need to know before you take Invokana? Do not take Invokana if you are allergic to canagliflozin or any of the ingredient of this medicine. What are the warning and precautions that you have to take in measure? First of all, talk to your doctor or pharmacist or nurse before taking these medicines and during treatment about what you can do to prevent dehydration. If you have type 1 diabetes, your body does not produce any insulin. Invokana should not be used to treat this condition. If you experience rapid weight loss, feeling sick or being sick, stomach pain, excessive thirst, fast and deep breathing, contact a doctor or nearest hospital straight away. So, what are the other precautions? If you have diabetic ketoacidosis, in which of one of the complications of diabetes, then Invokana should not be used to treat these conditions. In case if you are taking other medicines with Invokana, make sure you have to tell to your doctor or pharmacist. This is because this medicine, which is Invokana, can affect the way of some other medicines work. At the same time, this Invokana may affect the way of these medicines work. In particularly, tell to your doctor if you are taking any of the following medicines. Firstly, anti-diabetic drugs. Secondly, antihypertensive drug. And thirdly, digoxin. These are all those medication needed to take precaution. In terms of pregnancy and breastfeeding, Invokana shouldn't be used. Talk to your doctor about the best way to discontinue Invokana and control blood sugar as soon as you are pregnant. If you are breastfeeding, you should not take this medicine. Talk to your doctor about whether to stop taking this medication or stop breastfeeding. How to take Invokana? Always take this medication exactly as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. So, how to take this medication? First of all, you have to swallow the tablet with half glass of water. Secondly, you can take your tablet with or without food, but it is best to take your tablet before the first meal of the day. Try to take it at the same time each day. This will help you to remember to take it. If doctor prescribe canagliflozin along with bile acid sequestrant such as cholestyramine, medicine which used to lower your cholesterol level, you should take canagliflozin at least 1 hour before or 4 hours after the bile acid sequestrant.
If you missed a dose, take it as soon as you remember. If it is almost time for the next dose, skip the missed dose and take the medicine at the next regularly scheduled time.
So, how to store Invokana? Keep this medicine out of the sight and reach of children. Secondly, do not use this medication after the expiry date, which is stated on the blister after expiry. This medicine does not require any special storage condition. It should be kept under room temperature. Do not use Invokana if the packaging is damaged or shows sign of tampering. Do not throw away any medicines through wastewater or household water. This measure will help protect the environment. Thank you.